Cabinet has approved the vaccination of people between the ages of 18 and 35. This comes against the backdrop of notable vaccine hesitancy in recent days. Now, for what this new development means for the country's rollout program, I'm joined by Professor Alex van der Heever, who is the Chairperson of the Social Security Systems Administration and Management Studies at the Wits School of Governance. Professor, good to have you with us this afternoon on Daytime Update. Do you believe, and I guess from research and findings, will those aged between 18 and 35 actually take up this offer to be vaccinated?
Yeah, it's not entirely clear that we will get the maximum take-up from this group. But I think the important reason for doing this is to make sure that we still have a large volume of people.
Professor van der Heever, unfortunately, I cannot hear you at all. We have lost you there for a while. We'll try and get you back on another line, but maybe let me try again before we let you go completely. Professor van der Heever, can we try again with that answer, please?
Okay. I think that the introduction of this measure is not done principally to get everybody through, but to make sure that the volumes going through vaccination sites increase considerably, because we do have a significant number of doses that are available. And if we can just get people vaccinated, even if they're not necessarily in the priority high-risk groups, it will be better for containment of the epidemic. So I think that is really the rationale, and I think it's a very good move. I don't think we had a lot of choice at this stage. The vaccine hesitancy in different demographic groups is going to have to be addressed by dealing specifically with the people who've created this hesitancy and the sort of distribution of conspiracy theories, etc., that have potentially created uncertainty in the minds of many people. And we do need to address that directly as well.
The research, Professor van der Heever, has shown that the youth are a bit tardy when it comes to the vaccination. The level of hesitancy there is high. And that is largely because a lot of young people felt that they are not likely to get infected themselves. How is this going to be circumvented?
So the young people are going to be infected. So that's the first issue. A lot of people might feel, oh, well, we will just get the equivalent of a cold. Well, that might happen for some, but it's a roll of the dice. I'm sort of personally aware of a family within the last 2 days that have lost two of their children, age 31 and just slightly above. And that is the high-risk category. Many people are dying at this stage in lower age categories who people would have thought are not vulnerable. So actually quite a wide spectrum of people are vulnerable through all age categories. And although the risk is lower, the reality is that you're playing dice with your life. And a vaccination substantially eliminates the risk of severe illness and death. So I think that the hesitancy largely results from the fact that young people just feel, oh, well, this isn't terribly important for them. But that's a very poor way of thinking about the.
Will they also have to register through the portal, or will this be more of a walk-in arrangement for them?
So everybody essentially ends up being registered. You can walk in and register on site, but it's better. You can register in advance. You don't necessarily have to wait for an appointment in order to go through to many of the vaccination sites. So at this point in time, many of the vaccination sites are experiencing relatively low queues, which means people can go through very quickly if they arrive. But essentially, you process there, and any missing information on the registration system is completed on site, and so walk-ins are being accommodated. But the registration system is crucial to be able to track who is vaccinated and who is not. And that's also quite important if some people subsequently end up being infected and ending up in hospital, because we do want to be able to track the effectiveness of the vaccines as we vaccinate the population. So we are having strong indications of the prevention of severe illness and death, although there are breakthrough infections across the board. So it is important to note that the risk of infection potentially remains even post-vaccination, but there is a reduced risk of infection and certainly a very significant reduction in the risk of severe illness and death. But we do need to track that. Plus, ultimately, it's probably going to be the case that many employers and countries are going to require proof of vaccination for travel or entry to the organizations, and so that registration on the EVDS system is important to be able to verify that you've been vaccinated. It's also important for the follow-up dose, so you know when to come in for the second dose in the case of Pfizer, and potentially booster doses in relation to Johnson & Johnson.
Now, there has been the issue of non-attendance and very empty vaccination sites around the country. But the issue of the expiry date of the vaccination doses, was that actually an impending problem and perhaps one of the reasons why the 18-plus age group had to be moved forward?
Yes, it will be. Essentially, it would be absolutely tragic if we had to destroy doses. So the expiry dates are a valid concern. So essentially using up the doses with people who would benefit from the vaccine is quite important. If we were going to reach a situation where we're going to be left with expired doses, there are probably strategies around sort of pushing the second doses earlier, as well as introducing some booster doses for high-risk categories might be something that is considered. But I think the issue right now is just to keep vaccinating as much as possible. But certainly it is in South Africa's interest that a lot of young people are also vaccinated because they tend to be a high-risk group from a super-spreading perspective. They're more socially active. They're less cautious about going into risky situations. So the more of them that are vaccinated at least reduces some of the risk of transmission. Not all of it, but some of the risk of transmission.
There have been concerns about people with comorbidities. How do these concerns regarding comorbidities translate or affect the younger South African who will be vaccinated?
Well, some people, so first of all, people who are ending up with severe illness are not necessarily people with identifiable comorbidities. It's just a higher probability that people with comorbidities are going to result in severe illness than pneumonia and death. So it definitely increases the risk. But there are potentially risk factors which we don't entirely understand at this point. So people without any identifiable risk factor are also ending up with severe illness. And this might be related to how the variants themselves are mutating and creating the possibility of more severe infection than, for instance, the original virus that came into South Africa. So this is part of the issue we do have to take into account. It can be a bit of a roll of the dice, and it might depend on just with what viral dose you were infected with could affect the severity of the infection. Plus, with the latest variants, your viral load going up to such high levels that, in fact, it's causing a more severe infection. So I think that we don't have sort of final conclusive evidence on all of that, but it is accumulating. But at this point in time, it's not worth taking the risk at any age group of getting infected at all. Even if you have been vaccinated, you have to be very cautious about the possibility of being infected and transmitting the virus, particularly also to people unvaccinated. So vaccinated people can also still get infected and transmit, as well as people who were infected in the past. So there are a lot of people are being reinfected, and they are also still in danger of transmitting to all sorts of high-risk groups. So comorbidities are not the only concern, but they are definitely, if you've got them, you're definitely at higher risk.
Professor van der Heever, thank you very much for that update. As Professor van der Heever there. Tomorrow, which is the 20th of August, all those between the ages of 18 and 35 will now be able to get their vaccinations against COVID-19.